Lightning is about to strike twice. This GI Bill has all the potential of doing the same thing for this country that the original 1944 GI Bill did. Lightning is about to strike twice, and we're all going to be privileged to watch these youngsters prosper and benefit, and the country benefit from their leadership. Jobs. I recently addressed over 1,700 veteran small business owners at the 5th Annual Small Business Symposium on 21 July. I reminded them that veterans hire veterans because they know what they're getting. Customers and partners value their skills, veteran skills, knowledge, and attributes, and are eager to work with them. Just last fall, in a survey conducted by the Society for Human Resource Management, over 90% of employers said they valued veteran skills, in particular, their strong sense of responsibility and teamwork. VA in our own contracting, VA puts veterans first in our contracting awards because we recognize the on-time, on-budget, high-quality solutions veterans bring to our contracting needs. In fiscal year 2008, our unique Veterans First buying program resulted in VA spending more than $2 billion on veteran-owned small businesses. That represented 15% of our total procurement dollars, up 5% from the previous year. During that time, we also doubled our support to service-disabled veteran-owned businesses. That means 12% of our procurement dollars, $1.6 billion of the $2 billion was spent on service-disabled, veteran-owned small businesses. We're going to improve on those numbers next year. At VA, our experience is that veteran-owned small businesses have high likelihoods for creating new jobs, developing new products and services, and building prosperity. As I said earlier, veterans hire veterans, so increasing opportunities for veteran-owned small businesses is an effective way to help address the many needs that are out there today during this economic downturn. And VA now employs 18,000 mental health, homeless health care. We will spend $3.2 billion next year to reduce and prevent homelessness amongst veterans. $2.7 billion of that amount will go to medical services to deal primarily with general medical condition, but also mental health issues of depression and substance abuse. $500 million of that amount, of the $3.2 billion, will be used to go to the specific homeless programs that are out there in our communities across the nation. With 85% of this homeless funding going to health care, it means that homelessness is primarily a health care issue, heavily burdened with depression and substance abuse. The psychological consequences of combat affect every generation of veterans. And VA now employs 18,000 mental health professionals to address our mental health needs today. We know if we diagnose and treat, people generally get better. We also know that if we don't diagnose and treat, they won't, and sometimes, in some cases, their problems become debilitating. And we understand the stigma issue that's associated in this country and in the military with mental health. We understand the stigma issue, but we're not going to be dissuaded. We're not giving up on any of our veterans with mental health challenges, and we're definitely not giving up on our homeless. Homeless housing. As I mentioned, we have approximately 500 partners in nearly every major town and city across the country helping us get homeless veterans off the streets. Swords to Plowshares, Catholic Charities, you know most of them. With 20,000 HUD-VASH vouchers from the Department of Housing and Urban Development and our $500 million investment in 2010 to cover safe housing rehabilitation for veterans that we have been able to coax off the streets, we're going to reduce the number of homeless veterans next year and every year thereafter, as I said, for the next 5 years. So, education, jobs, healthcare, housing. We have work to do here. I think we have momentum, but we know where we're headed, and there's a lot to be done. Now, President Obama has charged me with, at the same time, transforming a VA into a high-performing 21st century organization. It'll be a different organization than the one that exists today. 5 years from now, the intent is that VA will be the provider of choice for more of that large population of 23.4 million veterans, the 15 million who are not part of our population. We intend to be the provider of choice in insurance, in health care, in education, in home loans, in counseling, in employment. To achieve this kind of status with veterans, because it is a choice with veterans, we must make it easier for them to understand those entitlements, and we must make it far simpler for them to access their benefits and health care services. Beyond the 5 years, we're looking for new ways of thinking and acting on the problems we deal with. We're asking why, 40 years after Agent Orange was last used in Vietnam in 1970, this Secretary is still adjudicating claims for service-connected disabilities associated with its toxic effects. Why 20 years after Desert Storm, we're still debating the debilitating effects of Gulf War illness. Because you see, left to our present processes we use today, which is based on a scientific method, left to our present processes 20 or 40 years from now, some future secretary could be adjudicating service-connected disabilities from our ongoing conflicts. Here again, we must do better, and we will. Now, if you haven't already heard, the Institute of Medicine, who has the medical ruling on these issues, recently released a new study on a possible link between Agent Orange and heart disease and Parkinson's, the two current issues that I'm wrestling. We have this study under review now by a task force, and I assure you we are going to get this right. Now, my remarks this morning comprise a 7-month, that's as long as it's been, seems like 7 years, but it's been 7 months, 7-month progress report to the DAV membership on the state of your department. I intend to do this next year. I intend to have more to report next year. Much more remains to be done. We need the continued support and assistance of DAV if we are to become that provider of choice. My mission is to serve veterans by increasing their access to our benefits and services, to provide them the highest quality of health care available, and to control costs to the best of my abilities. Doing so will make VA a model of good governance. Doing so will also keep faith with Lincoln's charge to care for those who have borne the battle and grant them the dignity and respect they deserve until they're laid to rest, and then thereafter. That is my mission. I'm going to leave here today, and I'm going to go to Aurora, just down the road, and we're going to break ground on the new VA Medical Center, the new Denver VA Medical Center. It's been 10 years in the coming. Veterans in this area and the surrounding states have deserved that hospital for a long time, and so we're going to go get that project started. I look forward very much to a continued productive partnership with the DAV as we move to the future. If on any day in my life there is a connection with the needs, which is represented by this audience, and the project down the road here in Aurora, today is the day. And so very happily, we're going to go break ground. God bless our men and women who serve in uniform, serve the cause of peace. God bless our veterans, and God bless our great country. Thank you very much.
Thank you, Secretary Shinseki, for all those inspiring remarks. We understand you have important matters that require your early departure. Thank you again for visiting us today.